Hello, today's video will be about the social stigma regarding the practices of hormonal optimization and hormone replacement therapy. Society nowadays accepts that women use hundreds of things in order to age gracefully or look and feel better. Makeup, Botox, cosmetic surgery, clothing that reshapes or covers certain parts of the body, you name it. This is considered totally normal and acceptable by current society.
Yeah, that's pretty true. That's true, and yeah, that's true. That's true.
There is, however, a massive stigma regarding men trying to optimize their hormones through testosterone replacement therapy, which is also known as hormone replacement therapy or hormonal optimization. Many people consider it steroid abuse, while it isn't. It is an actual medical use case with a bioidentical hormone that allows you to mimic having the testosterone of a natural 25-year-old man. This helps men deal with lots of problems that are a direct cause of having low testosterone, such as low libido, erectile dysfunction, a lack of energy, higher levels of body fat that can lead to higher aromatization that can lead to having gyno. Having gynecomastia means that a man can develop breast tissue that looks like as if it was from a woman. Furthermore, having these higher levels of body fat also results in holding more water. Holding more water can lead to higher levels of blood pressure. And another byproduct of having low testosterone and higher levels of body fat and having poor aromatization is that you will potentially experience mood swings. And last but not least, when your hormones are completely out of whack, you can also start to experience things such as anxiety. Now, I would say that having issues like these are reason enough in order to want a cure for your problems. Granted, there are methods in order to lower your body fat and raise your testosterone naturally. But if you're already going to the gym, you're already optimizing your sleep, you're already optimizing your diet, and you still have low levels of testosterone, then testosterone replacement therapy can present a solution for you. And I don't think that society should shame you for wanting a better and optimized life. Also, it really isn't steroid abuse because all you're trying to do is trying to get optimal levels of a natural 25-year-old man. We're not talking about cycling with high dosages of exogenous testosterone that result in a lot of problems that I will completely disregard for the use case of testosterone replacement therapy. We'll go over the claims that many people make nowadays in a little bit, and I will also explain you why this is incorrect. But before we get into that, there is, in my opinion, also a use case for just wanting optimization of your hormones as you're aging, even though it's not a risk-free decision, which I'll cover in a little bit. Hormonal optimization can lead to aging more gracefully, with more energy and higher levels of muscle mass through the entirety of your life. I find this a good enough reason to pursue it if done responsibly. Free testosterone is very important because it is the type of testosterone that determines how much muscle you will build and maintain throughout the rest of your life. As you age and your SHBG goes up while your total testosterone comes down at the same time, your free testosterone will become smaller and smaller, and it will become harder and harder to build and maintain muscle mass. Testosterone replacement will keep your total testosterone high and your SHBG at a favorable range. You will be able to keep going to the gym and train harder until a later age, but also you will have better erections, higher libido, and a ton of other benefits. Let's paint two scenarios here. On one hand, you have an average 60-year-old Western person. This person, as of now, will probably be overweight and have very little energy and is really just waiting for retirement to happen. On the other hand, if you are 60 and you're on hormonal replacement therapy, you can still play with your grandchildren. You can go out and get your own groceries. You will have lower levels of body fat. You will be able to go to the gym. You will have the energy for it as well. And your libido is still up to date as if you were 25. These are things that the average person nowadays, especially in the West, does not experience at these ages anymore. This means that the quality of life, especially at a later age, is vastly improved. However, over time, more and more research has been done, and generally speaking, TRT is not bad for your health. It doesn't raise the risk for cardiovascular diseases or prostate cancer, for example, unless you already have pre-existing conditions. These claims do, however, apply to people that use superficial physiological dosages for longer periods of time. They do have increased risk of high blood pressure, cardiovascular diseases, prostate cancer, and a plethora of other nasty side effects. However, today we are covering hormone replacement therapy. So we're talking about mimicking the natural levels of a 25-year-old person for a longer duration during your life. And in those cases, research has not been able to show that it's bad for your health. However, it does have downsides. It comes with reduced fertility or no fertility at all. And also, it usually results in you having smaller loads. Now, this is totally up to you whether or not you think that this is a trade worth making. In order to preserve fertility, there are things such as HCG, human chorionic gonadotropin, in order to stay fertile. You could also increase your loads by taking HCG as well, or selenium, or whatnot. I use multiple of those, and I have to say that yes, my loads have gotten smaller since I started using testosterone, but overall speaking, it's not that big of a deal. So again, this is a personal choice, but especially when you're getting older, the fertility part doesn't really matter that much to most people anymore. There's not that many people that decide to have kids when they're 50 years old, for example. And like with everything in life, there is no free meal.
Are you serious?
Cosmetic surgery also comes with risks. Botox also comes with risks. And I would argue that those actually have way less upside than TRT has for someone who actually needs it. And you shouldn't allow anyone around you to shame you for it, not even family. If this is something that you need or something that you want in order for better quality of life, don't let other people that don't understand what it means and then don't have to deal with the issues that you're dealing with dictate your decisions. So even though at the beginning of the video I put up a disclaimer, I do want to emphasize it once more. I am not telling everyone to go run and go get testosterone from someplace and just put it in your body and just YOLO it. I am talking about actual hormone replacement, usually done with a doctor at later ages and you being informed. But generally speaking, this video was about the stigma surrounding hormone replacement therapy, and that I just don't think that most of the claims are valid and that you shouldn't feel ashamed for wanting to optimize your life. Please subscribe for more self-improvement related videos. I will be posting much more often in the upcoming time now that I have a way better microphone and I hired a second editor. Big things are coming. Stay tuned.